I appreciate your work at NIH, and the CDC does vital work for the nation, yeah?
Correct.
And I know, Dr. Rodgers, you don't produce the budget request, so this is not directed at you personally. But I want to raise once again for the committee and the public my bitter opposition to the Trump administration's proposal to cut the CDC budget by more than half in fiscal year 26, which will have a devastating impact.
At a Senate hearing, Senator Jon Ossoff, DGA, delivered one of his strongest rebukes yet of the Trump administration's proposed budget for fiscal year 2026, which includes deep and unprecedented cuts to the Centers for Disease Control and Prevention, CDC. In an exchange with Dr. Griffin Rodgers, director of the National Institute of Diabetes and Digestive and Kidney Diseases, NIDK, at the NIH, Ossoff highlighted the importance of federal research collaboration, while warning that eliminating entire CDC divisions would devastate public health.
Dr. Rodgers, NIH collaborates with CDC on the special diabetes program, correct?
That's correct, Senator.
And have you had positive working relationships with many of your colleagues at the CDC?
Very positive relationship. I mentioned one earlier on, the search for diabetes in the youth, which has been funded through this special diabetes program. And it's not only detecting that there has been over time an increase in the incidence of type 1 diabetes, but also in type 2 diabetes. What I was taught when I was in medical school, we called it adult onset, but we're seeing this now in kids 10, 12, 14, and that would not be possible without the collaboration that's long-standing now with the Centers for Disease Control.
And appreciate your work at NIH, and the CDC does vital work for the nation, yeah?
Correct.
And I know, Dr. Rodgers, you don't produce the budget request, so this is not directed at you personally. But I want to raise once again for the committee and the public my bitter opposition to the Trump administration's proposal to cut the CDC budget by more than half in fiscal year 26, which will have a devastating impact on epidemiological defense and health research to defend the American public from deadly diseases. And I would note, Madam Chair, that the administration's budget request proposes to eliminate entirely the CDC's diabetes division responsible for data collection and research, and to eliminate entirely the CDC's division of nutrition, physical activity, and obesity. And I will fight this effort to destroy the CDC with everything I have as a member of the United States Senate. And if we, on a bipartisan basis in the Senate, do not defeat this effort to gut the CDC, the American people will pay for it in lives, in suffering, for decades to come. And I want to thank you again, Dr. Rodgers, for your work at the NIH, and respectfully request your assurance that any information that the committee may need in order to better understand your activities and also your collaboration with the CDC and the vital role that the CDC plays in defending the nation, you'll provide to the best of your ability to this committee. Do I have that assurance?
You have it, Senator.
Thank you, Dr. Rodgers.
Senator Jon Ossoff's questioning of Dr. Griffin Rodgers began on a collegial note, focused on the long-standing collaboration between the National Institutes of Health, NIH, and the Centers for Disease Control and Prevention, CDC. Dr. Rodgers emphasized the positive, productive relationship between the two agencies, citing the Special Diabetes Program as a prime example. Through this collaboration, critical research has been conducted to track alarming increases in both type 1 and type 2 diabetes, including among children as young as 10 years old. What was once known as adult-onset diabetes is now appearing at younger ages, underscoring the vital role that federal research and surveillance play in identifying trends, allocating resources, and guiding prevention strategies. Dr. Rodgers stressed that such findings would not be possible without the deep, long-standing cooperation between NIH and CDC. Sen. Ossoff then turned to the heart of his concern, the Trump administration's FY26 budget proposal. While clarifying that his comments were not directed at Dr. Rodgers personally, Ossoff denounced the proposal to slash CDC funding by more than half. He framed the issue not as an abstract budget matter, but as a looming public health crisis that would leave the country dangerously unprepared for emerging diseases and long-term health challenges. Ossoff drew particular attention to the proposed elimination of the CDC's Division of Diabetes Translation, the nation's hub for data collection and applied research on diabetes prevention. He also warned against cutting the Division of Nutrition, Physical Activity, and Obesity, which plays a crucial role in monitoring and combating conditions that contribute to some of the nation's deadliest chronic illnesses. By wiping out these divisions entirely, the administration's budget would, in Ossoff's words, destroy the CDC. He vowed to fight with everything I have to stop the proposal, stressing that if Congress fails to act on a bipartisan basis, the American people will pay for it in lives and suffering for decades to come. This sharp rebuke reflects Ossoff's broader legislative focus on protecting health research and public health infrastructure. Since taking office, he has consistently emphasized the importance of scientific integrity and robust federal investment in disease prevention. His comments come at a time when public trust in government health agencies remains under pressure following the COVID-19 pandemic, making funding debates even more consequential. Ossoff's exchange with Dr. Rodgers highlights a core reality. Research breakthroughs and disease surveillance cannot exist in silos. They depend on collaboration between agencies like NIH and CDC, backed by sustained congressional support. The data gathered on childhood diabetes trends is not just academic, it is essential for designing interventions that can save lives. Eliminating the very divisions responsible for collecting and analyzing such data would blind policymakers, healthcare providers, and communities. At the conclusion of the exchange, Ossoff asked Dr. Rodgers to commit to providing the committee with any information needed to better understand NIH's collaboration with CDC. Dr. Rodgers agreed, reiterating NIH's commitment to transparency and partnership in the fight against chronic disease. The moment underscored the stakes, whether Congress will uphold the country's investment in public health or allow sweeping cuts that could dismantle vital infrastructure. For Ossoff, the choice is clear, and he is prepared to lead the fight against what he describes as an assault on the CDC's mission. Senator Ossoff's remarks were more than a budget critique, they were a call to action. At stake are not just numbers on a ledger, but the health and safety of future generations. By opposing the administration's proposal to gut CDC funding, Ossoff aligned himself with public health experts, researchers, and millions of Americans who depend on strong, science-driven federal leadership to combat chronic diseases. His vow to fight with everything I have signals that this will be one of the defining public health battles of the coming budget cycle.